Yes, a thread lift will look absolutely natural in the sense that with aging, there is a descent of tissues in that direction, which causes jowling here and a piling of tissue in this area, which is the cheeks. So the thread lift repositions that tissue along the jawline where it was when the person was more youthful. And also it can create a little bit of lift along the jawline, which will address the jowl, or a saggy, squaring jawline and restore the heart shape of the face, or, I mean, the previous shape of the face itself. In terms of the neck, what we have noted with excessive redundant tissue in this area, the thread lift will recreate a very sharp, defined jawline for pretty much everybody. And also, in severe cases, the thread lift can definitely improve a redundant jawline. So definitely a thread lift will look natural. Also, there is one thing that we have to remember: a thread lift does not add volume to your face. So for those people who have the fear of looking swollen, the term that is coined is pillow face. I mean, that can't happen with a thread lift. Obviously, you're swollen a little bit after the first few days, maybe up to a week after the initial procedure because of trauma and the anesthetic that we inject. But otherwise, I mean, yes, it looks absolutely natural when the swelling has subsided. A thread lift procedure, depending on the areas of concern, thread lift for the face, for example, will take around 30 minutes once the anesthetic has set in. So let's say with anesthetic, taking the pictures, the whole procedure should be around 45 minutes. We pretty much give the same sort of time for the neck. So if you're doing the face and the neck on the same day, it will be around an hour and a half maximum. If you plan to do just a brow lift, which is this part, like that, so that will take normally around 30 minutes. For people who have signs of aging, I mean, at any stage of life, a thread lift can help. A thread lift doesn't replace a surgical facelift, but it can basically act as a buffer between you now and the next, and eventually the surgical facelift. So it can delay basically how by a few years the need for an eventual face or neck lift. Right. I mean, that's a very good question. So there has been a lot of controversy and we have a lot of threads on the market. The threads that I would tend to use most of the time is called Aptos, and the design of that thread is unique and the material is different from other threads as well. So an Aptos thread is a thread under your skin for up to 2 years, while other threads tend to dissolve after 6 months. So obviously for the 2 years, you've got mechanical support. So at least 2 years, and it can go up to 2.5, 3 years because of collagen production, which is induced by that thread. So a thread lift is mainly repositioning tissues with a thread, which is initially it was a surgical suture. Now we have different threads made of different materials. So the thread has little hooks which hook onto the fatty tissue under the skin and repositions with mechanical traction, of course. Now, a facelift, a surgical facelift, is a very invasive procedure which is done under general anesthetic. The thread lift itself is done under local anesthetic. Takes, like I mentioned before, between 45 minutes for the face, 1.5 hours for face and neck. It's done under local anesthetic. You can go to work the next day. There is minimal pain after that. I mean, there is no involvement of surgical instruments or any sort of major surgery. A facelift is major surgery, which is done under general anesthesia. And the recovery time is much, much longer. I've seen people having recovery times of maybe multiple months at least. After the thread lift procedure, I mean, I will, depending on your case, obviously, we advise you not to have, especially if it is the face, not to have exaggerated mouth movement like chewing gum or chewing on nuts and things like that, and not to open your mouth too wide for the next 3 weeks. There is swelling, there can be potentially bruising, which we can't avoid, unfortunately, which settles over time. So it's like a downward curve. It's not like, for 3 weeks you remain swollen and then the swelling suddenly disappears. It slowly goes away over the next 3 weeks, the first week being the worst. You can, by all means, go back to work the next day, and you are advised to take paracetamol. You are advised also not to indulge into water sports or going to the gym, doing any sort of strenuous activity for the next week or two.